Okay, so this is a video about the knee joint, which is a hinge joint, right? You can flex and extend your leg, so it's kind of like opening and closing a door. So this is a hinge joint. This is basically this area is the tibial tuberosity, where the tendon of the quadriceps muscle extends. The tendon comes through and over the patella and extends as the patellar ligament and attaches to the tibial tuberosity. Okay, now remember, recall from the tibial video, or the femur and tibial video and lectures, is that these are the femoral condyles, and these in here are the tibial condyles. And look what a great mechanical structures we have here. Here's lateral, here's medial. So this is, if I can get it right, this is the lateral meniscus, and this is the medial meniscus. Lateral meniscus and medial meniscus. And notice they form these raised areas above the tibia to form cushions, but also to increase the surface so that you have more stability. So those are the two menisci. Now let's talk about these two ligaments. This is the lateral collateral ligament, or the fibular collateral ligament. And this one that's torn, poor patient, this is the medial collateral ligament, or the tibial collateral ligament. Both are correct. So we've talked about these two ligaments and the two menisci. Now we have two additional ligaments. This one here that attaches, goes from the lateral aspect of the femur to the anterior aspect of the tibia, is the anterior cruciate ligament. And then on the posterior side, but it kind of goes here. This is the posterior cruciate ligament that goes from the medial aspect of the femur to the posterior aspect of the tibia. Now, what happens, and actually there's another ligament here that attaches to the meniscus that I'm not going to talk about. But what I want y'all to know about these cruciate ligaments is that the anterior cruciate ligament prevents the hypermobility of the tibia anteriorly compared to the femur. So it prevents the tibia from moving too much forward, whereas the posterior cruciate ligament prevents the tibia from going too much posteriorly compared to the femur. The anterior cruciate ligament is attaching to the tibia on the anterior aspect, and the posterior cruciate ligament is attaching to the tibia on its posterior aspect. So literally it prevents the anterior cruciate ligament. So if this is anterior and this is posterior, it'll prevent the tibia from moving too much forward, and the PCL will prevent the tibia from going too much backwards.